everyone, I'm Hasnain Patel, final year Mbbs from Vadodara, Gujarat. Today in this video lecture, we will continue the remaining part of general consideration toxicology. We will learn duties of a doctor in case of poisoning and antidotes. Notes of this video lecture are mentioned down in the description box, so no need to write anything. Before I start, I want you all to recall one movie, a very iconic one. I have watched this multiple times during my childhood. This used to come on a movie TV channel called Mbbs. I believe most of you have guessed this movie, the movie Suryavansham. The point which I am trying to draw over here is that an incident occurred in this movie where a lead actor got a food article, kheer in this case, and then he started having symptoms. This is a case of a suspected homicidal poisoning. The main point over here, if similar incident occur in a society and patient comes to your hospital, Dr. Sahab, that I have consumed something and I started having symptoms. So as a doctor, what are our duties and what are we supposed to do? So doctor has two duties. One is a medical and the one is a legal. A medical duty of a doctor is to take care in the treatment of a patient, and in legal duty is to assist the police to determine the manner of death. If a patient comes to us, doctor are supposed to be expert in this field, and opinion of a doctor matters a lot in a court hearing. So doctor must confirm his suspicion before expressing an opinion. That patient comes to us with the symptoms and we just can't tell that he is having poisoning. We have to confirm first. So when patient come, firstly we have to take a proper history. We have to take a history of route, quantity that has been consumed and time that has been passed, and carefully observe each and every symptoms, and we have to make a documentation, okay, what happened. And we can even consult our senior practitioner. If we need some guidance, we can talk with our senior practitioner, but confidentiality must be maintained. And move a patient to a hospital, because this could be a poisoning case which has been done by a family member. We never know, we can't take a risk, so we should insist the patient to move to hospital. But if patient refuses, we can appoint a nurse who shall administer the patient with drug, food and medication. Maintain a detailed record of a patient and allow no one to be with patient alone. Any suspected article of food excreta and stomach wash samples should be preserved. These are evidence. We have talked about the general, what we are supposed to do. We have to take proper history, proper record. Now we will talk about the legal duties. In legal duties, every hospital is obligation is to treat the patient of poisoning. Hospital can't just refuse a patient that you are poisoning case, we have to talk with the police, I can't admit you. This is illegal. We, in a hospital, it's legally obligation to treat the patient of a poisoning. Legal duties are, first is to preservation of evidence. Food article, excreta, vomiters, they are evidence, because poisoning can be detected in these different samples. So first is the evidence preservation. If evidence is not preserved, it is punishable under BNS Bharatiya Nyaya Sanhita 238 and earlier IPC 201. Secondly is the adequate documentation. Why I talk about the note down each and every symptoms? Yes, because we need, it's our legal duty to have adequate documentation. Thirdly, we have to inform police that this incident occurred and we suspect this is a case of a poisoning. If it is a private hospital, private practitioner, they are supposed to inform police in case of the homicidal poisoning only. It is not legally bound to inform a suicidal poisoning. And in a government setting, in a government hospital, suicidal or homicidal poisoning has to be informed to police. If it is not informed, it is punishable and it is under PNS 33. And last duty is to arrange the dying declaration. Understood so far? Generally, we have observed, like, take a proper documentation, take history. In duties, legal duties, 4 things we have learned: preservation of evidence, adequate documentation, police inform the police, and arranging dying declaration. Now we will talk about our medical duties. We have to take care and treat the patient. So how we can take care and treat the patient in case of the poisoning? First is the resuscitation. We have to stabilize the patient. As we have learned from our first year, A, B, C, D, airway, breathing, circulation, and CNS depression should be corrected. So first is the resuscitation. Second is the decontamination. Decontamination is a removal of unobserved poison, a poison which has not been observed yet. There are many poison which are observed through various route. We can stop the absorption route. For example, in case of the OP poisoning, we have learned that OP poisoning can be observed through skin as well. So firstly, we have to remove the clothes, decontamination part, because the unobserved poison don't get absorbed in the circulation. Thirdly is to remove the observed poison. Observed poison can be removed through the various methods we will learn in a further lecture. And fourth is the neutralization. If a poison already has been observed, we have to neutralize it, we have to counteract it. And fifth is the symptomatic treatment. So medical duties, we have 5: resuscitation, decontamination, removal of the observed, neutralize the antidote, and symptoms. This is the care of the patient. Medical duty is to take care, and this is how we're going to take care. Starting with the airway, breathing, and circulation. Firstly, in airway, we have to clear, open and clear up the airway, that is oral cavity and nostril, and even the endotracheal tube if necessary. Second is the breathing. We can supply the oxygen supply. Third is the circulation. We can give IV fluids. Understood so far? Let's go further. We have learned medical care. First was the ABCD, airway, breathing, circulation. Secondly is the removal of the unobserved poison. So how are we going to remove the unobserved poison? There are various methods. So if a poison is inhaled poison, we will give the O2 supplementation. So O2 supplementation will remove the unobserved poison. If it is an injectable poison, we will make a ligature and above the wound, and the ligature should be loosened every 1 minute, every 10 minutes for 1 minute. Why? If we don't loosen the ligature, it will cause the stagnant of the blood and can lead to the necrosis and gangrene. And if it is a contact poison, as I mentioned in OP poisoning, clothes should be removed. And in case of the ingested poison, we have to do gastric lavage. Now let's talk about gastric lavage. How we can do gastric lavage? Gastric lavage is done using a stomach tube. Example are eval tube, Boas tube, and lava curator. And fluids are used in gastric lavage. In a simple word, a tube get administered inside the stomach, and a fluid are withdrawn. So let us learn about this tube which are used. We talk about this tube which is used in a gastric lavage. It is called Eval's tube. It is made of rubber. There is a marking at 50 centimeter. A 15 centimeter that has till this point, it has to be inserted inside. There is this portion is called suction. This is our suction bulb. This is suction bulb. This is suction bulb. This is rubber tubing. This is a funnel over here. So till this point, it has to be inserted inside, and fluids are inserted through the funnel, and it is aspirated and evacuated. So the unobserved poison do not get observed in a circulation. Understood so far? We learned 4 ways to stop the unobserved poison to insert into the circulation. Its length is 1.5 meter and diameter is 1 centimeter. Let's go further. So what are the contraindications in doing gastric lavage? So contraindication, first is a corrosive poisoning. Because corrosive poisoning, there is a risk of perforation. As we have already studied in our first lecture, there are poison due to changes in the stomach mucosa. So corrosive poisoning, there is high risk of perforation, so we can't do the gastric lavage. There is one exception, carbolic acid. In our previous lecture, we have also mentioned carbolic acid cause the leathery stomach mucosa, so there is a less risk of perforation, so we can perform gastric lavage. Secondly is a comatose patient, because in comatose patient if we try to do gastric lavage there is a high risk of aspiration. Third is convulsant. In convulsant patient we can't do gastric lavage because it can induce seizure. And fourth is esophageal varices. And now we have completed the second part of our medical care. First was ABCD, that is resuscitation. Second one was remove the unabsorbed poison. Thirdly, we have to neutralize the absorbed poison. So how we can neutralize it? So we neutralize the absorbed poison with the help of antidote. So what are antidotes? Antidotes are the substance that counteract or neutralizes the poison effect. This is very important for an exam point of view. And even in Viva, a question asks describe antidote and classify antidote and explain antidote, like this simple question they ask. So how we can classify the antidote? Antidotes are classified in 3 categories. First is mechanical, second is chemical, and third is a physiological. Physiological antidotes are also called as pharmacological antidote. We will study the mechanical antidote. Mechanical antidote neutralize the poison by mechanical action or prevent their absorption. Firstly, we'll talk about activated charcoal. What activated charcoal do? Activated charcoal absorb the poison because it has many active sites. First, it is mixed with the water and a slurry is formed and it is administered. And superactivated charcoal has more absorbing power and absorbing surface compared to normal charcoal. Then we have demulcent. Demulcent form a protective layer in a gastric mucosa, so that it does not allow the poison to damage the gastric mucosa. For example, milk is also used as demulcent. Bulky food. What bulky food do? If there is many small glass particle, it will just get blocked in a meshwork of the bulky food. So it will prevent the glass powder to damage the gastric mucosa and intestine. So we talk about mechanical antidote. In mechanical antidote, what you have studied: activated charcoal, demulcent, and bulky food. Now let me tell you more about multidose activated charcoal. Multidose activated charcoal is very helpful because it even remove the poison from plasma. Usually from intestine the poison goes to plasma in our bloodstream, but when we provide multidose activated charcoal, poison from plasma will remove and come into the intestine. Question arises: how this occur? How multidose activated charcoal remove the poison from plasma and bring it into intestine, and from intestine it get excreted? So question arises: how? Have created a very good drawing classification. Do not draw this in your examination, this is just for understanding. So multidose activated charcoal form a concentration gradient. So in a plasma, if you can see over here, these are our poison particles and this is our activated multidose activated charcoal. So it bind with the poison, and so as a result there is a concentration gradient between the plasma and the intestine. So the poison from plasma will come inside our intestine and it will get excreted. So how we can give multidose activated charcoal? As name suggests, multi-dose, we give in a small dose. So first we give a loading dose. Loading dose is given 1 to 2 gram per kg, and this is given at the interval of 4 to 6 hours. Then afterwards we shift to 0.5 to 1 gram. Loading dose is always high because we have to reach to a threshold. So loading dose 1 to 2 gram and then 0.5 to 1 gram. So we have completed our mechanical antidote. And remember, antidote divided into mechanical, chemical, and physiological. Now we will go to our second part, that is our chemical antidote. So how chemical antidote help? Chemical antidotes counteract the action of poison by forming harmless or insoluble compound. Look, this is our angry poison. Then our chemical antidote will neutralize the poison by forming a harmless or insoluble compound. So it is neutralized, it won't harm our body. So now we'll go to the third part, the third antidote. that is our physiological or pharmacological antidote. So what this antidote do? These antidotes act on a body and produce symptoms exactly opposite to those caused by poison. So if a poison is making us unhappy, they are making us happy. This is just for a simple illustration. So this is the action of antagonism. So what action a poison is forming in our body, this physiological or pharmacological antidote will produce exactly opposite. So it will counteract with each other and it will get neutralized. So this was the third portion of our antidote. Before we go further, I want you all to recall what we have studied. Duties of a doctor, medical and legal. Medical duty, take care of patient. How we take care of patient? Five. First was resuscitation. Second one was removal of the unabsorbed poison. Third one was removal of the absorbed poison. Fourth one was neutralize it, and fifth one was to give a symptomatic treatment. And legal duties, four. First was evidence collection, proper. Second was adequate documentation. Third one was to inform police, and fourth one was to arrange for dying declaration. We have studied antidote 3 times. Mechanical we have done chemical, and third one was physiological. In physiological antidote, now it comes chelating agent. Now we come to the very important chelating agent. Chelating agent are used to treat the heavy metal poisoning. They are included in a physiological or pharmacological antidote. So what is the mechanism of action? So chelating agent over here you can see have higher affinity compared to endogenous enzyme. Look, our chelating agent is running faster compared to our endogenous enzyme. So they bind with heavy metal and prevent the endogenous enzyme to bind with the heavy metal. So what happens if an endogenous enzyme bind with the heavy metal will inactivate that enzyme. So the function of enzyme which is supposed to do won't occur. That's why we use chelating agent. So it bind with heavy metal and save the endogenous enzyme from binding with the heavy metal. I hope you understand. So chelating agent also helpful in excluding the heavy metal. So let's learn about chelating agent with examples. First we will learn BAL, British anti-levisite. So it is used in a poisoning of arsenic, mercury, lead, copper, gold, thallium. You can remember with the AML, acute myeloid leukemia. I hope you remember that one from pathology. So AML, CGT, AML, arsenic, mercury, lead, copper, gold, thallium. What is the mechanism of BAL? BAL has the unsaturated sulfidyl group. It combines with the heavy metal and prevent the endogenous enzyme from binding. We have seen in that photo. Look, chelating agent are running faster compared to the endogenous enzyme, and they are running towards for example, they are running towards our heavy metal. So by this method, they prevent the endogenous enzyme from binding with the heavy metal. And now we'll talk about our second chelating agent, that is EDTA, ethylene diamine tetraacetic acid. It is now exclusively used for lead. Very important. If there is a lead poisoning, we give EDTA. It is also used in mercury, copper, cobalt, cadmium, iron, nickel, but mainly it is for lead. Now we talk about the penicillamine. Penicillamine or cupramine is a hydrolysis product of penicillin. It is mainly used in a copper poisoning. Then it is also used in lead and mercury poisoning. And fourth, last but not least, our ferroxamine. Ferroxamine is used for iron, as even name suggests, ferroxamine. So it is used for iron poisoning. There are other methods. First is urine alkalination and urine acidification. Urine alkalination is used for acidic drug, and urine acidification used for alkaloid drugs. They help in the excretion of these drugs. So, and now remove the absorbed poison. And there is one more method, that is hemodialysis. So by this method we can remove the absorbed poison. I hope you guys remember so far. Summary box right now, what we have studied so far: duties of a doctor, medical and legal. We learn about how to take medical care. We have divided into 5 parts. We learn ABCD, then unabsorbed, absorb poison, neutralize the poison, and last was symptomatic treatment. The antidote we have classified: mechanical, then another was chemical, third one was physiological. Mechanical, we learn about our first was activated charcoal, demulcent, and we also learn about the bulky food, and we also learn how multi-dose activated charcoal works. They create the concentration gradient. Then we also learn about the antidotes, and antidotes in physiological antidote, chemical and physiological, and our chemical antidotes. In physiological antidote, we learn also about chelating agent, different type of chelating agent we have learned. So this was the summary box. I hope you guys remember, and thank you so much for watching. We'll continue in our next video lecture, and if you have any suggestion, please let me know in the comment section. I will try to improve every day, single day. Thank you so much. Stay curious, keep learning.